I'm Rini Paul. I know the majority of you, but for those of you that may be new to QMEC or not joined us before, I'm Rini Paul. I'm one of the other teacher development leads and a GP in North London. And I am delighted to welcome today and introduce Dr. Lois Haruna-Cooper, who is a fellow GP. She is a UCL alumni and is back at UCL as the EDI lead, so the Equality, Diversity and Inclusion lead at UCL. Lois has been interested in widening participation and in equity in education for a long time, and she found that having conversations with her students, she was sort of frustrated by the lack of progress, and that's led her to some of the work that she's doing. So we invited Lois today to really share with us a slightly different perspective and to hear what UCL are doing. So I will hand over to you, Lois.
Good morning, everyone. Thank you so much for inviting me. It's a pleasure to be here. Just going to try and share my presentation. So hopefully you can all see this clearly. So I'll be talking a little bit about race equality in the curriculum at UCL Medical School. As Rini kindly introduced, I was there previously as a medical student, so I was back there in 2005 to 2011. And I've been involved in volunteering for many years. So since I left, I've been involved with Target Medicine, which is their widening participation unit for the medical school. And I've since been back as part of the education consultancy part of the medical school. So I've been at UCL for a long time, so it's given me a really unique perspective and seeing it from different angles, both as a student and staff, and that's helped with some of the work that I've been doing. Oops. So what I hope that you understand by the end of my talk today is just have a bit of an understanding of the timeline of the curriculum changes that we've done at the medical school from a viewpoint of racial equality. I'm going to give you an overview of some of the individual sessions, just so you can see some of the work we've done and how we're trying to impart this knowledge onto our students. I'm going to give you some examples of good practice from some of our colleagues that are outside of the EDI committee, but who are still also embedding kind of racial equality into their teaching and the work they do. And also, what are our plans looking forward? So before we start, I think it's quite important for me to provide some context into our work around race equality and curriculum development. UCL has also always been a university of inclusion and about challenging status quo. And the medical school is really no exception to this. It's got a Decolonising the Medical Curriculum team, which has been addressing inequalities in the curriculum for many, many years. However, in 2020, following the murder of George Floyd and the resurgence of the Black Lives Matter movement that followed, we felt there was a real shift amongst our students. And we started hearing more and more experiences of racism within the medical school and their clinical placements. And for me, especially when some of the experiences were so similar to things that I had been through, I felt really frustrated that nothing had really changed, and it sounded like there was a lot of pledges and a lot of things were happening within the university and within the medical school, but the students didn't seem to be feeling the impact of that. And that was something that really galvanized me to say, okay, well, what can I do? So over the course of kind of spring and summer last year, there was a real effort to create a culture and create an environment where students felt comfortable to be able to share their experiences and to be able to speak about what they had experienced. And not just talking about it, but actually translate what had happened to them into real changes and making sure that the information was gathered and put together. And so what we did is we formulated an action plan, and this was across the EDI committee, so not just from race and ethnicity issues, but also LGBTQ issues, faith, parenting and caring, and mental well-being. And we had 4 main sections in our action plan: policy and practice, student experience, staff and training, and the curriculum. And that's the area that I'll be focusing on today. But it was really important for you to understand that actually the curriculum is just one part of the puzzle, and it won't really work if we are making curriculum changes in isolation, because this needs to be mirrored throughout the medical school. So over the past year, we created a lot of new sessions for the curriculum across all years, but it felt quite reactionary. So it felt like we were made aware of a problem or we identified an issue, and then we could try to kind of plug that gap or plug an absence in the knowledge that we noticed with this session. And although the sessions have been very well reviewed, I'll talk later about how over the course of the next few years, we wanted to change our direction slightly with that. So there's some of the sessions that we introduced are listed here, and what I will do is I'll go through some of these specifically over the next few slides, just talking about what the content of them were and what the purposes of them were. When we did introduce these sessions, we realised that it's very difficult just sometimes to talk solely about race and race equality without considering some of the other intersections that will be impacting our students. And so these are the sessions that I've pulled that kind of specifically that have a race focus, but there were many other sessions that we included that were much more intersectional. And if you look at the content of these sessions, actually a lot of the aims and the objectives cut across lots of different values and lots of EDI subgroups. So we started off with the year for our first year medical students with a bite-sized talk on the medical school and race equality and what we were doing. And for us, it was really important that when students came into the medical school, they had a good understanding of what was happening and what we were doing, and also who the UCL committee was in case they had any issues or any suggestions or they wanted to get involved. And this was quite difficult because we were aware that there was so much going on with Black Lives Matter and students just being very vocal in the community about what was affecting them. And so we wanted to make sure that students knew that we were aware of this and we were embracing it and we were trying to make changes, but also we didn't want them to feel worried at all that, you know, they're going to have an unpleasant experience throughout medical school. And so it was trying to strike that balance of here we are, this is what we're doing, and also just remembering that they're reminding them that they're ambassadors of UCLs and what our expectations of them are in terms of their behaviour and the way they conduct themselves. So this next session, Cultural Competency and Safety, was actually designed and delivered by medical students in their latter years, in their 5th and 6th year. Sarah, one of the students, did a BSc in anthropology and is one of the core members of the Decolonising the Medical Curriculum team. And this session really sets out to explore the GMT guidance around the importance of cultural factors in patient care, the complexity of culture, and how to learn to avoid stereotyping, essentialising and exoticising other people, the meaning and the difference between cultural competency and cultural safety, and the model of cultural safety that can be applied to social interactions and also within institutional cultures. We wanted students to understand their positionality and who they are, including their particular backgrounds, their upbringing, their identities, beliefs and worldviews, and how this may shape their unconscious bias. And also the importance of reflexivity and understanding who they are in their relation to the environment around them, and develop a self-awareness and empathy towards others. So these were the 2 main sessions that we delivered in year 1. There were also some other sessions delivered by some of our students, looking at a student who had recently graduated, did a session called the Sepsis 6 of racism. And that was just his take on his approach and what they can do individually within their clinical environment and within their university environment to try and prevent themselves perpetuating some of the issues that are going on, and be anti-racist, be active bystanders and be good allies to their colleagues and patients. In year 2, we delivered a session called Justice, Equality and Health. And this is one of the sessions that was delivered in the students' vertical module, so clinical and professional practice. So it was delivered by the tutors. So we actually had a session with the tutors beforehand to go through the presentation with them and the session, to answer any questions that the tutors had, and also give the tutors a bit of a training before they then had to deliver the session. And with any of these kind of topics, we feel that sometimes, although it's not always possible to deliver it in small group settings, they're really perfect for stimulating conversation and delving a little bit deeper. And so where possible, we do try and make a use of our small group teaching sessions and CPP sessions, ethics and law sessions, to try and really allow students to have these conversations and be a lot more active and participate in them, rather than just kind of taking in information. So this session was really to improve the students' understanding of how racism can impact health and healthcare, and the medical school, and the role that they should play themselves in tackling this. We wanted them to understand how racism and racial microaggressions can contribute to adverse health outcomes. We wanted them to be able to describe the impact of discrimination on their learning environments, and reflect on their own positions of privilege and how this might affect them as a learner and also as a care provider, and explore the ways that they could affect change as a medical student to improve patient outcomes. And also describe how they can start thinking about their learning and how they interact with the materials they're provided with, so that they can put themselves in a better position to treat a more diverse population. So at UCL, students intercalate in their 3rd year. So we didn't design any sessions for the students because they would obviously be in different departments. But moving back onto the 4th year, we felt that one of the key things that we really wanted students to understand is that when we talk about health inequalities and we talk about racism within medicine, there's often this misconception that it's being perpetuated by people who, people have a stereotypical view of what a racist is, then they're a big bad person, and they go out with evil intentions. And it was really kind of breaking that down and helping students understand that actually the majority of the health inequalities we see are committed by good doctors who are doing their best and who are unaware of sometimes the unconscious biases they have and how the trickle-down effects of these can cause these health inequalities. And so it's getting students to really be reflective and be insightful and be intentional in the interactions they have with patients, and being mindful of the information that they receive, the information they might not receive because of barriers that might be there, that not necessarily their fault, that patients perceive, and what they can do to try and overcome these. And so this session was really to get students just to critically reflect and commit to being an inclusive doctor. And obviously a large part of our interactions with patients is taking histories and communicating with them. And so thinking about just the general history taking performer, and what questions are we asking? How do we ask these questions? What information we receive, and making sure we're really thoughtful about each of these interactions. And also, if there are things about us, or if there are things that patients might assume about us, what can we do as clinicians, or what can we do as doctors, as medical students, to try and break down these barriers and make patients trust us and be willing to share information where there might be some hesitancy or fear. In year 4, we also had a session on responding to discrimination and raising concerns. And this was really to improve students' understanding about how and when to raise concerns and how they can be an active bystander. And this session kind of incorporated an existing session about raising concerns that was already in existence, but we had a lot of feedback from students that they didn't really feel that it taught them or facilitated them having a better understanding of how to raise kind of racial related concerns. And this is just a really good example of when I talk about it's not possible to do these teaching sessions in isolation. We realised that actually just teaching them about raising concerns and what they should do in the right pathways wasn't enough, because on the other side there was a lot of difficulties students had interacting with our official raising concerns platform. And we then had to look at that and say, well, actually, what is the problem here? How can we improve the student interaction, improve student engagement, make the process more transparent so that they're aware of what's going on, improve feedback back to students when they do raise a concern, and make it clear to them the types of concerns that they should be reporting, and making them feel comfortable that if they're worried about something, yes, they can use this, and the process should be clear to them. So that's just a run through of a few of the sessions that we have included. Other examples of good practice that are happening across the medical school are our anatomy and dissection department have improved their image stock and provided more diverse resources. There was student feedback about concerns that the cadavers that they had access to, and also some of the interactive material, didn't really represent a wide range of patients, and they felt that actually they're learning anatomy in a very specific way and they might not recognise variations in different body types and different skin tones. And so they reacted very, very positively to student feedback, and it's an ongoing work for them, but they've already put some changes in place. Similarly, our dermatology department are going through a massive workload to go through all their teaching materials and update their images with pictures of patients with black and brown skin and not just white skin, so students are used to recognising common and rare conditions and serious conditions in a wide range of skin tones. The clinical and professional practice lead has been very proactive in trying to think about how they can include racial equality training for all the tutors. So these are tutors that run small group work on a weekly basis with our students as part of their vertical modules, and how we can equip them to be better tutors from this point of view. Similarly, we know that students' learning is very much driven by assessment, as Sarah kindly highlighted earlier in her presentation. And part of our work is that we know that some students won't necessarily see this as an issue for them or important for them. And so it's really important for us that any changes we make to the curriculum, any new learning objectives that we put in, is reflected in assessments as well. So students are aware that this is something that they need to know, and it's part of the fundamentals for them to be a good doctor. And so the assessment team that's one part of the work that they've been doing, is making sure that we can reflect some of these changes throughout the assessments, both formative and summative. As a committee and as the EDI lead, I've been invited to I think all the teaching committees now, the executive committees and we've got faculty representation. And I think it's just really important that this isn't work that can happen in isolation. It's not something that can be done by just one person. And it's really important that actually everyone within the medical school plays their role in whatever job they have. It doesn't necessarily have to be student facing. There are things that happen throughout. And as I mentioned before, policy and practice is part of a large part of what we're doing, and professional services have been very instrumental in helping us move some of these points forward. But it's really important that we, one, present our message in a way that helps people understand how they can engage with it, makes them want to be involved. And we think it's, you know, it's really important because it does affect us all. It affects all the students and it affects all the patients, either directly or indirectly. So where do we go from here? As I mentioned earlier, the work we've been doing over the past year and a half has felt quite reactionary. We were very overwhelmed with the amount of student feedback and the student experiences that were mentioned to us last year, and we very much wanted to not lose momentum and show students that we were taking on board, you know, the comments that they made to us. And so a lot of the sessions and the material that we've been designing so far has been in reaction to that. What we want to do going forward is be a lot more proactive in our review of the curriculum and implementation of changes. And we know for this to happen, it's not going to be a case of just adding on session, that EDI is something that has to be embedded throughout all of our teaching materials, from physiology to pharmacology to kind of more practical teaching sessions. We need to have a deeper look at our educational constructs and our Eurocentric approach to medical education and think, is this universally applicable? And one of the key things about what we've been doing at UCL Medical School is just the way that we've been working so closely with our students. And we've actually got a Changemaker project that's been happening for the best part of 6 months now. And this is a collaboration between the EDI committee and the Decolonising the Medical Curriculum team. And they're looking to review the curriculum, and they've been reviewing the curriculum from EDI point of view to incorporate decolonial, which includes anti-racist, LGBTQ plus inclusive and intersectional perspectives into the existing EDI curriculum for all years. They'll be reviewing the current sessions that we have, some of which I've gone through today, and also developing a structure for the EDI curriculum. This goes alongside a much larger body of work that they've been doing, looking at just reforming the curriculum in general and thinking about, you know, where does the research that we use for teaching about pharmacology and evidence-based medicine come from? Is it really representative of our population? When we think of good practice, when we think of quality, where do those ideas and markers of quality come from? A lot of, as I mentioned before, a lot of these things are kind of Eurocentric approach, and we know that actually we're working in a global university and we're treating a global population, and do these models suffice? Are they sufficient? I think central to everything is just that we continue collaborating with our students, and I know at King's you've done a lot of work with your students. I know Ola Yinka and Alexandra, I believe, have done a lot of work with the Afro-Caribbean Medical Society and the medical school in terms of bringing similar issues to light and working forward to see how they can be addressed. So I think the take-home messages is, one, this change is well overdue. Although we're doing a lot of work now, we realise that we're not, a lot of the things that are coming to light are not new. They've been reported for 10, 20, 30, 40 years plus. Talking to students is very important. I think there's a wealth of information and literature exploring racism in medical education and how to approach addressing this. And I think this is really important because as much as we work with students, I'm always very mindful of how taxing it can be and how burdensome it can be, especially when you're reliving trauma and difficult episodes. And so I think it's our responsibility to say, well, have we saturated ourselves with all the other information that's out there? So when students coming to us, we're not having to ask them to explain things that we could have easily read elsewhere. We're not asking them to tell us things that we could have gained from elsewhere. They can share their experiences and they can share things that we can't necessarily learn elsewhere. And that's just really just to remove that kind of emotional toll on them. At the same time, it's great that they're doing so much, but they're still here to get their medical degree. And that in itself is an awful lot of work. And so I always have at the back of my mind, are the students doing too much? Is this something they can cope with? And it's great that they want to be so involved, but I think we also have a duty to protect them and safeguard them as well. And I think also just amongst ourselves, we just need to consider the idea of this minority tax. And if this isn't a kind of a conceptual phrase that you're familiar with, it's essentially the idea that when we talk about racial equality work and when we talk about LGBTQ rights, we often find that the people lobbying for these things are the people that are affected by them the most. And so this is an extra strain, not just emotionally, but it can be in terms of career progression, it can be in terms of opportunities, because their time is so consumed by doing this work that they miss out on the scope of a lot of other things. And so it's just considering how we utilise the staff that are doing this work, what demands and what requests we put on them, and make sure that we're considering this when we do it. So thank you very much. And that's my kind of overview of what we've been doing at UCL Medical School, and I welcome any questions.
Thank you so much, Lois. We're going to hold on for questions until the student presentations. I hope that's okay, and that you can stay with us. And our student presenters last year for our conference were Olayinka and Alexandra. So it was really nice. We wanted to invite you particularly to hear what UCL are doing and see what we can learn from each other. And I think you've set this up beautifully for our next two presenters.